Thank you for joining us for the St. Louis Metropolitan Pandemic Task Force Daily Briefing with Dr. Alex Garza. The briefing will begin shortly. Dr. Garza will take questions that have been submitted by members of the media after he makes brief remarks. Reporters who have questions during the briefing may also submit those to the task force public information contacts, and we will attempt to address those during the briefing or as quickly as possible after it concludes. I'll now turn the briefing over to Dr. Alex Garza. Thank you.
Okay, thank you and good afternoon, everybody. I truly hope everyone is getting ready for a somewhat restful weekend. And again, thanks for making time to join us for this briefing. I want to begin my comments by reiterating my appreciation and really deep respect for St. Louis Mayor Krewson and St. Louis County Executive Dr. Sam Page for extending the stay-at-home orders. I know this was a tough decision, but it was absolutely necessary and the right one given where we stand today. So let's go ahead and talk about where we do stand today. So here's the numbers from the task force hospitals in the St. Louis metropolitan area. As you can see, we have 684 hospitalizations, which is about the same as yesterday, where we had 687. We're still up 50% from where we started this 2 weeks ago. We had 173 intensive care patients, which is about the same as where we were yesterday at 179. And we have 144 patients on ventilators, which is slightly down from 155 yesterday. And the good news, we've had another 60 COVID patients discharged from our hospitals yesterday, so that is good news. These data continue to show us that we're making important progress and that our medical providers are doing phenomenal work in taking care of these patients and actually preventing patients from needing to go to the ICU and to be placed on ventilators, so that's good news. Again, the more we learn about how this virus affects our patients, the more effective we'll be at treating them, and we'll flatten the curve with us as time goes on. However, the surge is continuing. You can see by our graph here, it continues to go up, and we're still up over 50% from where we were 2 weeks ago. And that means simply that we have to do all we can to continue to suppress the number of cases and transmission in the community. So this is the graph that you've seen the past couple of days, and we've updated it with our new inpatient numbers. And based on our inpatient count, as I mentioned, we're still up nearly 50%. And we have to continue our relentless work to flatten and extend the curve. It's up to all of us to practice all of those things that we've been talking about here for the last couple of weeks. Staying at home, social distancing, washing our hands, and continuing to drive the numbers down. So it's going to be a short briefing here today, so I'm wrapping up my remarks, and we're going to take some questions from the media now.
Dr. Garza, this reporter wanted to see if you had any comment on Governor Parsons' described 4-tier plan to reopen the economy of the state. The plan is focused on things like boosting testing and the state's PPE reserves. And the reporter is curious as to whether you think that's something that can be accomplished by May 3rd when the state's order now expires.
That's a good question. Let me go back to what I said either yesterday or the day before. I can't remember which one. But the date isn't necessarily as important as the strategy and the foundational blocks that we need to have in place in order to deal with this virus going forward. And so the things that the governor laid out, I don't think anybody disagrees with. We have to have more testing, whether that is through our PCR testing or the acute care testing, or through immunology testing, which is the serology testing we spoke about yesterday. And that's so that we can get a better idea of what the prevalence of disease is in our community. So how much disease is there? Right now, because of the lack of testing supplies, we really don't know what the extent is of disease in the community. He had also mentioned expanded reserves of personal protective equipment, which again, I completely agree with. I will, though, caveat that with saying we're still operating as hospital systems under crisis standards of care, which means we don't have all of the PPE we would wish to have, And so anything that we can do to ramp up production or to get more supplies, we're certainly in favor of. Extending and expanding hospital or health system capacity, we feel like we've done a very good job of that. But I think where we could use some assistance as well is in preventing transmission rather than increasing healthcare capacity. If we increase healthcare capacity, that means we already have an increased number of cases. And again, the objective is to decrease number of cases. So that would then lead me to believe we need to do other things out in our communities to decrease transmission. And so whether that's having more quarantine facilities so that people that can't quarantine at home have a place to go, taking care of our at-risk populations, particularly our homeless and other populations like that. And then we need to have improved public health infrastructure as well. And you've heard me talk about this testing and tracing strategy. And so in order to be able to identify where the hot spots are in the community and to be able to really clamp down and decrease transmission, we would need a much more robust platform than we have right now. So don't disagree at all with the underpinnings of it. I think the data is irrelevant. We have to have that strategy and that infrastructure in place first.
Thank you, Dr. Garza. That concludes the list of questions received from members of the media prior to and during today's briefing. In the morning, we'll accept questions from members of the media for tomorrow afternoon's live stream. Thank you for tuning in.